The ideal candidate for a Tommy John reconstruction is someone who has sustained an injury to this ligament and is having pain, difficulty with range of motion, difficulty with the throwing motion, has lost velocity on their throws, and cannot get back to the same level of function as they had prior to their injury. We often take our patients through a conservative treatment protocol with relative rest, ice, anti-inflammatories, and a focused therapy protocol working on particularly the flexor pronator mass strengthening, which is a secondary stabilizer to the inside aspect of the elbow. And we even now offer platelet-rich plasma injections along this area to help augment some of the healing and reduce inflammation and give ourselves an opportunity to potentially treat this non-operatively. In the event that a patient fails this conservative treatment, at that point in time, we may consider a patient the ideal person to move forward with a reconstruction. And a reconstruction would entail harvesting a tendon either from the forearm or from the leg area and using that to weave through the bone on each side of the joint to help reconstruct the tissue that is no longer functioning within the elbow. We do this through an incision along the inside aspect of the elbow and then a very regimented recovery process. There is a newer variant to this surgery, and it's called a ulnar collateral ligament repair. As opposed to the reconstruction where we're putting new tissue in to reconstruct the tissue that's no longer competent, in this surgery, it's usually safe for our younger athletes who have a well-preserved ligament, but it's avulsed off of the bone as opposed to have degeneratively broken down. And as a result, we can go in there and repair the ligament and back it up with an internal brace suture. And it does not require obtaining a ligament, or rather a tendon, to reconstruct a ligament from the rest of the body. And this actually affords a patient and an athlete to return to play faster than the reconstruction, on the order of about return to play at 5 to 6 months versus 12 to 13 months with the reconstruction.